Hello, I'm Vina Barrett. We're here on TTT, joined by Talk City 91.1 FM and TTT Live online. While there have been no confirmed cases in Trinidad and Tobago, many say it's just a matter of when it happens. Covid-19 continues to be at the helm of discussions around the globe. General practitioners are the first line of defense, and they are the ones with whom patients will have to interact. What measures have the private sector been implementing to safeguard themselves? Also, there's been a surge in demand for various products, including the N95 masks, hand sanitizers, and cleaning supplies. There have also been reports of restrictions on the export of certain drugs due to supply issues. Joining us to shed light on these areas are President of the Pharmacy Board, Trinidad and Tobago, Andrew Rahaman, and medical practitioner, Dr. Kris Sookdeo. Gentlemen, welcome.
Thank you. Thanks for having us.
Mr. Rahaman, I'd like to start by asking you, just recently we heard reports that India had placed restrictions on some of their exports in terms of drugs as a result of COVID-19. Are you aware of this, and what sort of drugs can we expect to be impacted by this, and how is it going to affect us here?
Well, in the private sector, we don't really have an over-reliance on medication from India, but we do sell a lot from India. There is a demand, particularly in the lower socio-economic group. The public sector, we feel as though there's a bit of an over-reliance. And it might be a good and opportune time to review the reliance, because the cheaper the medication is, it tends to go with being less effective. So in the absence of proper testing of the medication, we do not see it as a horrible thing in the public sector. In the private sector, there are some persons that would not be able to afford the better medication, but we do have quite economic generics from Germany and other countries that we are much surer that they work properly. So we are not seeing it as overly worrying, although I'm hearing also that the EU is also keeping their medications for themselves. So when we have to go to first world countries, in that sense, we might be having an issue. But there are middle ground countries that have proper generics, good standards, excellent efficiency of the drug, that I even implore people in the pharmacies to purchase the middle ones and not the cheapest ones.
Some have said paracetamol and certain antibiotics may be affected. Can you confirm?
Well, we do have some decent supply from India, but we continue to have the brand names, which I have to admit might be much more expensive. And we do have some middle ones that are medium price, but I think we are much surer that they are efficient drugs and may well work better than some of the ones from India, because India traditionally has had problems with standards of manufacturing. Some has changed, and there are better standards coming out of some of the drug houses in India. But I think that the majority, or a large proportion, is still, the quality of the medication is still questionable.
Dr. Sookdeo, I'd like to also ask you, because I understand that you also have a company whereby you supply certain pharmaceuticals. Mm-hmm. Did you experience any sort of impact so far?
So in terms of our market, we would usually get from the local suppliers. Just this morning, the front desk placed an order for some, say, mid-ground type pharmaceuticals that we use for general cough and cold type symptoms. There was no restrictions in ordering. We ordered our normal quantity, and there was no lack of supply from the manufacturers or the suppliers' end. So we haven't been experiencing anything really from our standpoint.
Okay.
Yeah.
Mr. Rahaman, you spoke about reviewing reliance. As far as you're aware, are there any arrangements that can be made to mitigate the impact? Do we have any options to work with?
Well, I think on the public sector side, there are usually options but the options will have cost implications. We do not think that the cost implications will be exorbitant. In fact, it might end up being cheaper in the long run, because if the government were to supply medication for somebody for 10 cents for high blood pressure, it costs the government 10 cents and causes the patient to have an amputation, have to go to ICU. You will be spending thousands of times the amount of that 10 cents to see about the patient, as opposed to spending 25 cents on something from Germany that will generally avoid the patient reaching the point of stroke, amputation. So we actually think it to be penny wise and pound foolish to be buying medication that is so cheap in a situation where we don't have labs here to test it. So if we were testing and found the cheap ones to be efficient, I'm happy. But we are buying cheaper and cheaper medication, particularly for the public sector, and registering cheaper and cheaper medication for the lower socioeconomic group. And in the long run, I mean, I have an example of something that costs 30 cents for diabetes. It is an Indian product. The same German drug costs 55 cents. So if we are able to get the relevant results of the test for the 30 cents one, I have no problem. It seems not to be tested. There are no labs capable of testing it here, and we do not know that it is sent abroad for testing. So my approach is use the 60 cents one or the 55 cents one. It is first world manufacturing, and it will avoid the complications. Diabetes complications are too numerous to risk. And if the government, the responsibility will fall to the government to deal with the fallout, and it will be amputations, ICU, blindness, the list goes on and on, liver disease, kidney disease, and so on. So we really would like to see an adjustment in terms of just choosing the cheapest medication that can be found for the public, and to choose medication that is mid-price. I'm not even suggesting brand names. Go to mid-price, even 1/3 of the price. And we feel as though we are sure that you can get better effects of the medication.
Dr. Sookdeo, in terms of COVID-19, we understand that we are looking for certain symptoms that are aligned to the common cold. Have you noticed a greater demand for items like paracetamol and other drugs that we would normally use to treat the common cold?
Yeah, so in terms of demand, what we have to keep in mind is that it's not just only COVID-19 that is around. You still have your influenza that is always around, your common cold, your flu. So there was a supply constantly over the last few years. There was never really a shortage. But what has happened is that supply has stayed constant, whereas the demand has now increased, where you have a novel coronavirus new onto the system that was already supplying for X amount of expected cases in our sector, in our healthcare sector.
And in terms also of your arrangements and your supply chain, do you have a backup plan in the event that it's threatened in any way?
Yeah. So as Mr. Rahaman was saying, quite rightly, I agree with all his points to the queue. You have a wide range in terms of price. So for example, you're going to have, let's just use paracetamol from one company that, I'm just giving an average, it costs $1, and you have paracetamol from another company that has better efficacy, meaning it works better, it works faster, costing $2. In Trinidad and Tobago, we have a very wide divide in the socioeconomic platform in Trinidad. So what you have happening is that what I would rather have is somebody having a symptom, being able to afford a drug that treats the symptom, and rather than having regression, complete regression, you have control. So that disease doesn't progress on to different stages and phases where they now have to end up in ICU with all these different complications. It costs us a lot less in the long term than not using any medication at all. So we're pretty covered, I think, in clinical practice.
We've also been hearing, Mr. Rahaman, about shortages of the the certain masks that they use, the N95, and I even heard you talking about the R35. I'm not too familiar with that. Could you enlighten us a little bit? Is there really a shortage? Are we having a problem? Are people panic buying?
Well, yes. To answer the last one first, they are panic buying. There seems to be a shortage. There was a shortage some time ago. More and more we seem to be getting increase from suppliers. But there is still some restriction to some extent by some suppliers where they are not providing the pharmacies with the quantities they request. So in that sense, it seems as though we will step up to the plate, that is our importers. And as long as there is supply from abroad, purchase more and have more available to supply to the pharmacies. But up to maybe about 4 or 5 days ago, I was inundated with complaints that pharmacies were not able to get the quantities they were looking for. But more and more it seems to be easing. But as it eases, I think more and more people will start buying even more, and we may get back to that point. But as of now, it seems as though we have a supply, and the prices are, for the particular one, not the plain surgical mask, they want the N95. It is averaging to be retailing around $25 for one. So the cost is getting to a kind of prohibitive place for some people. And then those who can buy, who can afford, might be over-purchasing and creating that kind of temporary shortage.
I want to talk a little bit about the pricing as well as possible price gouging.
Yes.
Now, before I do so, I'd also like you to confirm, are you experiencing problems in your supply of the masks?
Right. So what I would have to do before I answer that question directly, I need to put some foundation.
Okay.
So Covid-19 discovered late last year, 2019. So it's been about 3 months in media throughout the world. There was a constant production of N95 masks. Just last night, I was speaking to a supplier in Shenzhen, in China, and the government has put certain restrictions, so this is directly from him, on export from China. So previously, Trinidad and Tobago, we would get our masks from 2 major regions. You get it from China, you get it from the US. So the Chinese supply was cut. We had a quantity of stock in Trinidad through various distributors, and then there was a preparation phase where Trinidadians, which is quite rightly in their right to prepare, purchase these masks. So you have a supply, it's being purchased, it starts dwindling, and now a supplier runs out of masks. So they then have to contact their manufacturer. China has a ban on exports. That was directly from with them out last night. So we contacted US. Recently, just last month, the end of February, you had cases of coronavirus coming to light in the US. So suppliers in the US are still supplying, but I'm not going to say holding on, but they're basically limiting the amount of export. And another thing you have to take into consideration is manufacturing requires manpower. So in China, if a factory worker can't go to the factory, which is going to happen if you have an outbreak, an epidemic, then that supply line slows down, literally stops, because somebody is not there to operate it. And that's really what you've had happening. Okay. Now, as the weeks go on and the months go on, I'll make it very clear, we have not had a case yet. It's all preparation. Yeah, we will have supplies in Trinidad. I can give you a real-life, on-the-ground scenario from this morning, if you wish. Sure. So at SPT Medical in San Juan, we retail. And what you have is non-nationals coming in to store to buy masks. And they would try to buy a very large quantity. And, you'd ask them, you see them every other day or every day. And what is happening is that they would purchase masks via DHL or so, then go back to certain countries where there are shortages. So what we've then implemented is the limitation on how much one individual can buy. So you don't want one person buying 100,000 masks, and then you have 100,000 other families not having access to masks. So I think it's smarter to limit the supply in that way. it's not putting a ban on anybody, it's not discriminating or anything like that. It's just simply making a smart decision to have Trinidad protected and prepared for when or if it does happen.
So you're not engaging in price gouging. However, Mr. Rahaman, you made several calls to doctors to avoid spiking their prices at this time. Have you been successful? Are they heeding your call?
All right. In relation to...
Certain, like masks, even drugs, pharmaceuticals.
well, it would be the wholesalers have done so in the past where there is no control per se. We in the pharmacies have 30% markup for certain items, 25%. So there is legislated markup of drugs on the retail side. So it wasn't in specific relation to now, or it may well be happening now. More, it was in relation to the fact that on an average beginning of a year, we get letters from the wholesalers saying the prices will be going up 10%. The prices will be going up 10%. We understood it when the dollar was devalued and so on. But because there is no control over the wholesale sector, they seem to have, they have freedom in just adjusting their prices. So a lot of times the pharmacies get blamed for it, and our markup is fixed. But if we buy something for $10 today and sell it for $13 tomorrow, if the wholesalers indiscriminately increase their prices annually and carry it up to $13 as our cost, we cannot sell it for $13 anymore. So the main source of price increases, or the only source, was from the wholesale end, because the pharmacies are not permitted to and have not been marking up more than the legislated percentage that we are authorized to mark up our pharmaceuticals in the retail sector. And if we do, we will be priced out of the market of our competitors who are close by. So we, in the retail sector, keep the law with regard to the markup 30% on average. There are things that are vatable 35%. But the wholesaler, as far as we know, have no restrictions whatsoever, and we see it annually, almost on an annual basis, where the prices we just get a letter that this line of products will be increasing by 10%, and it is coming year after year after year.
Okay. Yeah, sure.
I could add to what Mr. Rahaman was saying. So I understand the point of view from a retailer's standpoint, but you also have to take into consideration what the wholesaler is seeing. So if you, in a global market like you are today, where you can have large supply today, something happens and that large supply is completely out of stock in a week or two, as what happened recently. Your supplier in China is in one region. You're supposed to have a regular price, but now your supplier, the entire region, has to change to the US, and the price that you're now paying to get that into the country changes. So the person that will feel it is the retailer. So you would get a letter stating, hey, there's a 10% increase, but there is some basis or some backing behind it.
Yes.
And also you have the new import restrictions and stuff happening at the port. So you have to take all the current events, not just one individual scenario where we decide to increase it because there's increased supply or demand.
But I am talking about something consistent from 10 years ago, 9 years ago, 8 years ago. So I'm accepting it for now.
Yes.
But for before, we are constantly, I could bring a plethora of letters when this was not going on, where it will be increased. We get letters, it will be increased, it will be increased. And it is some of the very reputable companies who have good lines and who have the monopoly on those lines that are carrying up the prices.
Okay.
But the public, we face the public as the retailers. I don't own a pharmacy, but I work in retail pharmacy, so that's why I keep saying we. But we, in that sense, the pharmacists who work in retail bears the brunt of those increases by people as much as being obscene to us sometimes.
Yes.
Yeah.
We have
Pretty
so much
Yes.
more to discuss
Yes.
when we come back from this very short break. General practitioners, they're the first line of defense. How prepared are they? How safe do they feel? What's the purpose of the masks? What is the R35 mask? Is it really effective? We'll soon find out.
The exhibition was really nice.
And I really liked the experience. It was very good.
Of all the islands in the west, Trinidad's the one that is loved the best.
The winning numbers in the National Lottery online draws for Friday, 6th March 2020. At 10:30 a.m., play away the number 27, Little Snake. Pick 2 of the numbers 8 and 22 in that order, Mega Ball Call. Pick 4 of the numbers 7, 9, 9 and 2 in that order. At 1 p.m., play away the number 11, Turbo. Mega Extreme Ball Call. Pick 2 of the numbers 1 and 30 in that order, Mega Ball Call. Pick 4 of the numbers 8, 0, 4 and 5 in that order. At 4 p.m., play away the number 10, Monkey, Mega and Mega Extreme Ball Call. Pick 2 of the numbers 2 and 25 in that order. Pick 4 of the numbers 5, 9, 0 and 4 in that order. And at 7 p.m., play away the number 16, Jamet. Pick 2 of the numbers 24 and 35 in that order, Mega Ball Call. Pick 4 of the numbers 8, 7, 1 and 6 in that order. Cashpot the numbers 13, 2, 16, 11 and 17 in any order, and the multiplier is 4.
I designed for the cloth. I'm the creative director. I see fashion as a way of dressing a spirit, dressing a person. I would like to dress our otherness and make it be seen in the world. The biggest form of resistance or revolutionary act you can do is to purchase within the economy, and purchasing in the economy is taking all the visual and using it. That's the only way to invest in the space. You know it is important, and you have to put it out there, and people will see it. Even if 10 people, it has to be done. People catch on. I'm Robert Young from the Cloth, and I believe our story starts here on TBT, Trinidad and Tobago Television.
Welcome back. We continue our conversation here on the impact of COVID-19 on the medical sector, both private and public. We're also talking a little bit about the first line of defense. Is it really our general practitioners? I'd like to ask you, Dr. Sookdeo, the first line of defense, we often say, it's our healthcare professionals like yourself. How safe do you feel? How prepared are you? What sort of changes are you making in your office, in your practice, in order to safeguard yourself and those that are employed with you?
Okay. So that question, I want to approach it from 2 points. I will get Mr. Rahaman involved in a little bit. I'll tell you from my side first.
Sure.
So how well are we prepared? That's a very good question. It's a question that we should be asking ourselves every single day as this thing progresses. I want to use the word practice. So in 2019, Trinidad experienced swine flu, H1N1, bird flu. And we went to the point where we ran out of vaccines. The government had to make statements, had to reorder vaccines. And that was actually a very good thing because we made it through successfully. There were cases in terms of hospital admissions and from that point of it. But it gave the healthcare practitioners practice in preparation for respiratory-borne illnesses. So COVID-19 has come around. It falls into the exact same class. It's a respiratory-borne illness. It's spread through the air. And we keep asking ourselves, are we prepared? I would say yes, for 2 reasons. We have practice, and the second reason is, in the medical fraternity, every day it's a nice community. We speak to each other, and you have sharing of information, continuous sharing of information, which is very important. the guidelines. There are circulations with guidelines on how to treat patients. And in terms of us being prepared, yes, we are. This is the private sector, and the general practitioners 100% are prepared to deal with a issue if it does arise. The other point is, in your question, you said the first line of defense. So I want to get to Mr. Rahaman for this. In Trinidad and Tobago, there's a divide. We know this, it's our country, that's why we love it. In terms of the first line of defense, you have a strata of the population that can afford to go to a physician, afford to pay that visit fee before getting medication. And then you have another side of the population who would prefer to go to the pharmacist at the first sign of a symptom. What would be your view on that?
Well, there are certain symptoms that we authorize, even in the law, to treat. There's a certain point at which we refer them to the doctors. If it is that they cannot afford the doctors, we ask them to go to the public health sector. There are many health centers that are now open later and so on. That was the problem in the past. If you went to the hospital, it would be hours and hours, but then there are many health centers that are now going later. So for the common cold, the treatment of runny nose, the treatment of hacking coughs, treatments of dry coughs and so on, we deal with it. But when it comes to pneumonia, high blood pressure, diabetes and so, we defer to the doctors and we don't treat. We actually refer them to the health center or the public. But that said, because we are seeing that this is essentially viral in nature, traditionally, in a lot of cases, especially they can't afford the doctor's fee first, or when they afford the doctor's fee, then they can't afford the medication. They have a tendency to flock to the pharmacies.
So that's the first line of defense in some instances.
I would add to what you said.
So in that sense, we see them first, and depending on and I want to implore the public as I'm on it, that they tend to, because it seems as though the persons that end up with a bad outcome are persons who are compromised otherwise, the elderly, other comorbidities. But there's a problem we have with cough syrups in Trinidad, where they either use the cough syrups that the parents tell them to use, that they used from the doctor 10 years ago. And I think one of the things we want to keep away in this instance is bronchitis and pneumonia. So we have a thing as an example, the multi-symptom tablets. The average one has a cough suppressant with no expectorant.
Okay.
So I'm imploring the public, when they get these symptoms, whether it is from the present one or the other viruses, to come to the healthcare professionals. I have experiences where I am eliciting information from a customer to get to the root of it, particularly to get to the root of a need for an expectorant, for 4 or 5 minutes. And the person is listening to me. And somebody lands up next to them in 2 seconds flat and tells them what to use, and they forget me.
Yes. Now, Dr. Sookdeo, what sort of measures have you been implementing to safeguard yourself and your staff members? Is it that when people call to make an appointment, you ask them firsthand, what are your symptoms, so you know how to treat with them differently? Do you have a different room with which to address, to attend to them? What sort of measures have you been implementing?
So medicine has evolved so much over the past few years. 10 years ago, Granny would get to the door, she would enter, she would speak to the receptionist, and then only when she reaches into the actual examination room would you know what is happening with her. That has changed completely. The average 50, 60, 70-year-old patient has a cell phone. They call you beforehand and they tell you exactly what is happening, and they speak to the front desk. So what the private sector has done, what doctors have mandated, is that their front desk staff, the receptionists, their medical assistants, be very well trained and educated. So when somebody calls and says, hey, I have a cough, I have a cold, we know what's happening in the world, they immediately follow protocol. So you let them know what to do at home, you book them for an appointment. Before they enter the door, you equip them with personal protective equipment, whether it be a face mask or so. The reason why is if they enter into your waiting room, the average space needed for spread is 1 meter. That's shortening distance from here to you. In the average waiting room that is filled, nobody sits 3 feet apart. So what you have to do is you have to protect your patients. And then in facilities that have isolation rooms, so there's something called air isolation rooms, AIRs. You're supposed to place your patients into the AIRs, and that way that they're protected. You're then supposed to initiate a protocol where your staff now has to practice respiratory hygiene, cough hygiene, meaning everybody has to wear protective equipment, and that patient is now active. After that, there are certain protocols that I think we'll get into in a little bit, and what to do if you do suspect a patient has COVID-19.
So what if I just walk into your office without calling your front desk and I tell you, doctor, I'm having severe breathing problems, I'm coughing, I have a high fever, that sort of thing. What do you do in that way? I mean, I didn't give you the opportunity to tell me what to do beforehand. Right. How do you handle that?
Yeah. So I'm very glad you asked that question because it does happen. It's the real world. It's Trinidad. And somebody will come in, they will enter into your waiting room, but what happens is that in some facilities you have an access point or greeting before, and that person who's greeting that patient knows that, hey, these are symptoms that we should look out for because they are trained. Education in the private sector, I think, has come through leaps and bounds over the past few years. The average secretary knows this is something I need to protect my patients and workers from. You equip that patient with personal protective equipment, a mask or so, and you then follow the protocol that is in that facility.
Okay, so we spoke a little bit about the masks, right? You all mentioned a lot of masks, the R95, the N95, the R35. Are these really effective? What do they do, and who should be wearing them?
Okay, so in our population, again, we don't have a confirmed case. The ministry has been keeping abreast with this. They've had their regular releases, and they've been doing what they have to do. And what we have to do is in terms of patients who are at high risk, patients who may have past conditions, COPD, emphysema, bronchitis, asthma, patients who are immunocompromised, HIV-positive patients, tuberculosis, sarcoidosis, they should protect themselves.
Okay.
If you're going into a crowd, you're going into public, and you think that if you contract this thing, then it could potentially be fatal, you should protect yourself. But we should not just stick on masks. I think that has a trend to do with marketing, maybe, social media, that kind of stuff. Washing our hands is proven to be way more effective.
Okay.
Simply using your sanitizers, soap and water. Don't touch your mouth after you go touch surfaces, that kind of stuff. Clean your offices. Wash your hands before and after entering into a doctor's office is all much more effective than wearing a face mask.
Well, thank you so much. Unfortunately, we're out of time, but I'd like to thank you so much for joining us and informing us of so many things that we need to know about COVID-19 and being prepared. I'm Verna Barrett. Have a great one.